Welcome back to this week series of drugs that are used in the arthroplasty in terms of bone metabolism. First of which is the calcium supplements. So before we understand the different calcium salts that are commercially available as supplements, let's first understand the recommended dietary elements of calcium requirement that we need to take every day. When we see the RDA levels for adults, it's about 1000 mg elemental calcium per day, and age group between 51 to 70 years, the RDA is higher in females because of postmenopausal issues, and it is about 1200 mg per day. And in age group of more than 70 years, the RDA is 1200 mg per day for both men and women. So RDA for calcium, it is somewhere around 1000 mg to 1200 mg per day. Now let's look at the different dietary sources that are rich in calcium. So first being the dairy products, milk, cheese, yogurt, then vegetables includes green leafy vegetables, okra, broccoli, sweet potato, kale, tofu, seeds like chia seeds, sunflower seeds, fruits like custard apple, and dry fruits like almonds, apricots, dates, and nuts. And fish and egg yolk are also good sources of calcium. But when it comes to the supplements, so here we're talking about oral capsules that are prescribed for calcium supplements in patients with osteoporosis or vitamin D deficiency in the clinical practice. Most of these drugs either have calcium carbonate as a composition or calcium citrate. So if you look at the percentage of calcium, percentage of elemental calcium of these salts, 1 gram of calcium carbonate contains 400 mg of elemental calcium, whereas 1 gram of calcium citrate gives 211 milligrams of elemental calcium. So these salts are given in multiple supplements. So on an average of 500 mg to 4 grams per day is what is the dosage that is given usually, and it is divided in 1 to 3 doses. So mostly usual protocol would be 500 mg twice a day. And these calcium salts, if you observe the composition, it is always or sometimes mixed with different forms of vitamin D3 and minerals. So in the subsequent episodes, let's understand what are the different forms of vitamin D3 that are commercially available as oral supplements, and thereby moving on to the higher group of drugs that act in the bone metabolism. So this is in brief about calcium salts that are used in the capsules or tablet forms in the clinical practice that have a role in treatment of osteoporosis and vitamin D deficiency or insufficiency. Thank you.